Welcome to the Checkup. I'm Lauren Berryman, General Assignment Reporter at Modern Healthcare. Thanks for watching. Cybersecurity incidents within the healthcare industry continue at an alarming rate. Each year, tens of millions of patients are affected by healthcare data breaches. And looking at Modern Healthcare's data breach tracker through 2009, there have been more breaches from January through October of this year compared to the same period any other year. Patients' personal information is at stake, and health systems are paying high costs. With the national cybersecurity workforce shortage, health systems and others may face an uphill battle. Today, I have Chris Plummer here to talk more about healthcare cybersecurity challenges and ways to stay proactive. Chris is the Senior Cybersecurity Architect at Dartmouth Health. Welcome to the Checkup, Chris.
For having me, Lauren. It's great to be here.
Starting off with your position at Dartmouth Health, what does your role as Senior Cybersecurity Architect entail?
Wow, it's really it's a very broad role, trying to keep pace with cybersecurity threats, sort of all across the globe. Not necessarily stuff that's just happening to healthcare, but really anything that's happening on the planet could potentially happen to us. And so my role is to not only to digest that sort of every day, but understand sort of how do we mitigate those things. In the context of an academic medical center, in the context of a large health system, right? So, and that includes keeping pace with a whole breadth of cybersecurity tools and solutions that are out there to help out. But it's also understanding sort of the people and processes involved in augmenting those. So it's really tough. It's a tough game to take a day off in cybersecurity because that could be a big day. So you're kind of permanently plugged in, but you do that because it's fascinating. It really is fascinating work.
Well, we need people like you for sure. So how common is it for health systems to have a dedicated cybersecurity program? Is Dartmouth Health doing something different that other systems could benefit from?
Oh, no, I would say in terms of having a program, I would say I would venture all hospitals have a program at this point. The real question is do they have dedicated cybersecurity resources? I was interviewed a few weeks ago, maybe a month ago, and I went on record to say that something in the 90% of our nation's hospitals do not have that dedicated cybersecurity employee. And I've heard anecdotes for years. I've heard that number fluctuate sort of informally. Maybe it's 75%, maybe it's in the high 90s. I've never really found a source of record for it. So, but I would say, I've had conversations with many hospitals, and I'm fairly comfortable. It's certainly in that upper 3/4 range, right? That 75% and up, and that's kind of a frightening prospect considering how deep a cybersecurity program in a hospital really needs to be. So, of course, that's getting done by committee in organizations that lack the full-time resources, and it just further strains folks who are really there to do other work. And now cybersecurity is sort of a burden for them, which is unfortunate, but not uncommon. And we're very fortunate to have dedicated cybersecurity resources here at Dartmouth.
And certainly filling cybersecurity positions has been a challenge across various industries, not unique to healthcare.
Absolutely.
How is Dartmouth Health dealing with the national cybersecurity workforce shortage, and what strategies have you personally found to be effective?
Oh, sure. So I mean, now we're well into this sort of new normal where you can take a role anywhere on the planet at this point, and so we feel that. We feel every business feels that, right? Every business is sort of in this spot where its heroes, its sort of superhero employees are sort of shouldering a lot of weight right now. There are folks that it's just ingrained in them to sort of want to do this kind of, I would consider public service. So, so I think hospitals everywhere, no matter if it's cybersecurity or it's folks that are on the floor of a hospital, doing clinical work or anything in between, I think we recognize that we're doing our very best to keep those folks in-house, because if we don't have folks in seats in our hospitals, like doing the work for us, and we have to consider things like managed services, which hospitals have been doing this for decades, right? Hospitals have been looking to manage services to fill very specific skill gaps for a very long time.
Mm-hmm.
But I think especially in the work of cybersecurity, it takes this institutional knowledge that takes just years and years to cultivate, and it's so hard to outsource that. It really does take years of time, and so. And why is that? It's because hospitals are incredibly old. I mean, if you consider some hospitals are actually hundreds of years old. I mean,
Mm-hmm.
I came from a hospital before Dartmouth that was literally hundreds of years old. Right? So if you just consider that hospital has seen like everything there was to see about the evolution of technology, right? They were there for the very first computers. They were
Right.
there through the computers of the 70s, the 80s, the 90s. And in a lot of cases, and this is not a joke, some of those things are still very much there in hospitals. That is the legacy computing burden that a lot of hospitals bear. So it's really tough to pull in somebody fresh from the outside who's really only here on a short-term engagement to really understand how those pieces work together. We have long hoped for some signals from our federal government that there's some help on the way. I would
Right.
tell you 5 years ago, for
Right.
example, we felt very insulated. I think in healthcare, we felt like there were wheels turning, but we weren't aware of them. And so this year in particular, we've just seen so many great signs of change. I mean, if we think back even to May, we saw Josh Corman testify in front of the Senate, and where he illustrated sort of the state of affairs of cybersecurity in our hospitals and
Mm-hmm.
sort of the intersection of patient care and patient outcomes. Like we saw that broadcast on television, right? And then not just a week or two ago, we saw Senator Warner's report on sort of the state of cyber in the health sector. And that was a very broad-ranging report that touched a lot of areas of risk that we have really tirelessly worked to mitigate. So lots of signals there that on the horizon, we can really see some help there. But it's back to retaining our skilled employees, like through all means. Really, I think
Sure.
taking I don't think there's a hospital really in America that has not sort of taken a look at salary, for example. We saw during the pandemic a talent loss. All hospitals were looking to fill that, and I think they're looking to
Mm-hmm.
structurally fill that too. So of course, trying to be as competitive as possible on salary. Which let's be honest, we're talking about a nonprofit healthcare organization, right? This is not going to be the biggest paycheck of your life. There's no question about that. But it takes more than that to get you out of bed, right? So
Mm-hmm.
I think it's creativity. It's
Mm-hmm.
what can we extend in terms of, let's say, flexible work options, right? That's a thing now. Like I think hospitals traditionally,
Sure.
there's some trepidation there because you're talking about potentially patient data sort of flowing out of a hospital and maybe into somebody's house where they're working, and that was really hard to come to terms with. But I think we've done it over the last few years. I think all hospitals have done it. They've sort of solved that. So it's something that we can extend. A career advancement, of course. Like
Sure.
where are you going in the organization? How can we train you? How can we educate you? How can we make you a highly skilled person at what you do? How can we make you a fantastic cybersecurity resource, not only for
Yeah.
us, but wherever you go, right?
Right.
And then how can we? And then importantly, I must say, how can we recognize that work you do? Like the work of cybersecurity in a hospital is often it's kind of in the shadows. It can be thankless sometimes, but we must recognize that work. We must
Right.
recognize the work of anyone willing to wake up every day and come to work in a hospital.
Bringing those people in and retaining them is certainly very important, especially with the level of cyber attacks we're seeing in healthcare these days. Do health systems adequately prioritize cybersecurity, and what are the incentives to do so or not to do so?
Oh, absolutely. I think we've seen, particularly the biggest lever that I think we've seen in the last few years is certainly cybersecurity insurance, right? That has been a mainstay of any hospital cybersecurity program. Cybersecurity insurance is sort of evolving over the last few years in terms of its expectations of what a hospital security program looks like. So that's been an important driver for change in every hospital, and that has directly influenced hospitals' awareness of cybersecurity program and staffing.
And so, what advice would you give health system leaders about preparing for and responding to cyber attacks?
Yeah, so I mean, just can't be said enough. Retention is just number one. Your people are everything. If you don't have, you can't defend your house if no one's home. I mean, it's just that simple. We have some cybersecurity pillars that I think are not that. They're not often talked about. Really, I think they've really come into their own in the last year and a half or so. But things like asset management and vulnerability management and identity and access management, sort of tangential to privileged access management, and supply chain management, third-party risk management. I think these are things that are cornerstones of a security program, and they're very hard to solve because they're not, unlike email protection or endpoint protection, for example, which are places where hospitals bleed out profusely, right? And if you don't address those, these other pillars that I've discussed, they are not necessarily solved by products. They are programs. They require solutions, but they require people to run those solutions. And so they're very hard to wrangle, but they're very fundamental because, for example, without asset management, you really don't know what you're protecting, right? And everything flows sort of up from there. So providing that you have a good handle on some of these really critical areas like email and endpoint security, it's really starting from that, creating that great foundation, starting with asset management, and really building your program from the ground up from there. Otherwise, if the foundation's no good, I mean, it's like anything, the program will not operate at the level of skill that it needs.
Right.
Yeah. So I don't know. I think information shares for me too, I should mention, are so critically important. It's especially in some of these organizations where you are sort of the sole cybersecurity FTE, for example. You need to know someone else is out there going through what you're going through. And so I was able to do that by reaching out to my state fusion center, which invariably led to building relationships with all levels of our federal government, which is extraordinarily helpful. Fantastic conduits when we're under duress, or just have general questions about things we're seeing. But generating regional information shares has been so powerful for us. We have here in New England a regional information exchange amongst hospitals at the cybersecurity level. So hospitals can sort of remain competitive, sort of up here, right? And then down in the trenches, we're all just trying to keep the lights on and stay alive. We don't have a lot of secrets there. We're just trying to understand what's working, what's not working. Maybe that yields kind of an unspoken economy of scale. If enough of us are clamoring around the same kind of solution, then it sort of works out for us. Maybe financially, who knows? In order for us to manage risk in hospitals, we can't have any secrets around what's working, what's not working, who's tough to work with, who So that's incredibly useful. But without a doubt, cybersecurity in a hospital, so many bases to cover. It's really, really important to have something at every basic step of let's say the MITRE ATT&CK framework, for example. Instead of chasing sort of the best of breed for everything, which, and best of breed or the best solution for this or that is so dependent on the things around it, including the people. I mean, you could have a product that maybe in and of itself doesn't have a high degree of efficacy, but if you're the right person running it, that could be an exceptional tool. Or if it's just surrounded by a couple of other very complementary solutions, that can be far better than the quote unquote best thing on the market. So very, very complex equation there, but it'll keep us going forever. There's no question about it.
So, and kind of briefly, like a short answer, do you expect the threat level to increase, decrease, or remain about the same in the short term?
I think it will. It isn't going anywhere. I think the nature of hospitals is that we consolidate. We consolidate out of necessity for a number of reasons. And when hospitals consolidate, they become more complex. And when hospitals become more complex, their surface area, their attack surface increases. There's so many more things to look at and consider. Unfortunately, I don't think it's going anywhere. But as long as we have good folks ready to do the work, I think we're well prepared for it.
And lastly, looking forward, What's your message to everyone else working in healthcare? What can those outside of IT departments do to help promote cybersecurity?
Well, I'd say cybersecurity really is not, I mean, it is a formal department in most hospitals, but cybersecurity is really an embedded function of everyone's job. Like, cybersecurity cannot happen unless everyone is doing it. We can certainly be the ones who process the signals of cybersecurity and understand when things are going sideways, but we can't be secure if everyone does not sort of adopt that mentality that they are a cybersecurity person too. That is so
Right.
powerful, and we see that in our organization, and it's exceptional, and it's a really important message that I think needs to sort of pervade everyone working in a hospital. Cybersecurity is your job too.
That's a good takeaway for sure. Well, thank you, Chris, for talking with us
Oh,
and
you're
sharing
so
your
welcome.
perspective. There's lots to take in here, but it'll be interesting to see how things go from here, especially with the Biden administration announced in October its aim to strengthen cybersecurity in a few key industries, including healthcare. So thanks again,
Again, you're
and
very
thank
welcome.
and thank you all for watching the checkup.